Thanks for staying with us. The Bojanala and Dr. Kenneth Kaunda districts in the northwest have been hard hit by the recent surge in COVID-19 infections. The Provincial Health MEC Madoda Sambatha says the province has recorded an average of 300 new cases every day for the past 7 days. Sambatha joins us now to talk more about the COVID-19 outbreak in the northwest, as well as what's driving infections in the province. I believe, MEC, you're joining us by phone because, like many of us, you have been hit by load shedding. Thank you so much for your time. So, just in the last 24 hours to Sunday, the Northwest recorded 421 new infections, 428, I think it was, new infections, which took the number of active cases in the province past 6,800. How worried are you at this moment?
As a province, we are very worried about the growth on the new cases that are coming in the province. Of course, one of the serious problems we have as a province is that this growth appears to be dominantly through your school and between school kids and teachers outbreak. Because the number of people who are getting tested positive on a daily basis in that field of education is higher than any other number elsewhere. With that too, you have a very serious problem of identical growth on cases of people who would have attended a funeral of a person they knew was a positive case, and from that funeral, it attacks a group of families and a group of friends who would have gone to there, which then becomes secondary to transmission in the workplace on the basis of contact.
So I want to ask you about the schools issue then, MEC, and then we'll touch on the funerals in a moment. What do you propose as a solution to the spread of COVID-19 infections at schools in particular? Do we need to relook the attendance roster? There's just been an announcement, for example, that the primary school pupils will soon go back to full-time lessons as per pre-COVID times.
The first issue that we agree with the Education Ministry is that one, when primary school learners go to school, teachers for that category must have been vaccinated. It's something that we are working with the Department of Education because provincially we'll have a meeting tomorrow to discuss that jointly. Secondly, the issue we agree with the education fraternity is the issue of stopping contact sport. But that on its own stopping education is not going to help because the same kids who are not allowed contact sport in school are the ones who predominantly in community tournaments are playing contact sport. So we should go to contact sport in communities. The third element is nobody must organize a session that is going to involve more people without approval by health and approval by the circuit office or district office of the Department of Education. The last one, which again it's education suggested, the reduction and the adjustments on the attendance on the basis of reducing the number of people, because it has proven wherever there are higher numbers, there will always be a spread.
Do you think we need to go back to the conversation about a suspension of schooling as what happened in the early stages of lockdown last year?
Necessarily, it might not be schooling, it might be a more adjusted timetable for schooling. Remember, one of our serious problems, when we ended up at level 1, everybody in the community then believed that COVID is no longer a risk. Risk adjustment has to be tightened like the president has done in the last address, has to be tightened with control of mass movement because COVID is made to move by our movement. The reduction and adjustment of the timetable, ensuring that the virtual delivery is increased in all the schools, by the way, to also cover those that would necessarily do not have access to technology.
You've managed, as far as vaccinations go, to vaccinate about 70,200 people in the Northwest at the moment. Is supply meeting demand? And secondly, given the many rural parts of the Northwest, is the Pfizer vaccine that requires cool, ultra-cool storage suitable for many of those parts of your province?
Remember, one of the challenges with the issue of the vaccine, nationally and internationally, has been the issue of availability. On our projected plan by the National Department of Health, everything was projected to be properly under control, including who will get Pfizer, who will get J&J. Now, complications and delays on J&J have made Northwest Department of Health to then adjust its program to even deliver and administer J&J to deep rural areas on the basis of mobilization and transportation of those people to a central point where it could be easier to distribute Pfizer without breaking rules of cold chain. That we're doing, and it is beginning to be successful. The only challenge is, because it has a double dose, we will have to keep up by bringing the same people on their time. But the advantage is that the system of EVDS, just on the day of vaccination, it tells you when is your next jab.
All right then, Northwest Health MEC Madoda Sambatha, good to speak to you on Newsnight tonight. Thank you.